Ultrasound business and financial advocacy. A legal disclaimer we put at the beginning of all of our presentations. Information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. This topic is really important because when we talk about ultrasound, it's not just how to use the machine, what are the quality measures, how do we manage the patients, the ethics, the regulations. You need to know, is it a financially viable option to add to your service line, maintain it? What are the cost-benefit analysis of adding ultrasound services to your practice? We need to really go into a dive of what are those things, because whether you're owning your own private practice or you work for a hospital, they want to know the revenue streams and the services that the midwives and nurse practitioners, the physicians, the PAs are bringing in, and does it make sense to have that service line internal within the practice or outsource it to a radiology department or have a sonographer on site. It makes a difference in patient safety and outcomes. You want to make sure that there's enough funds and money and budgets allocated correctly for the trainings, for the upkeep, for the quality measures, looking closely at the income and expenses of what your budget's doing. Can you handle that expansion at that time? What are the strengths and weaknesses of adding ultrasound services to your practice at this time? Is it make sense, or do you need to wait till you hit a certain level of revenue, a certain timeline, a certain amount of providers? Those are important things to consider. Service and revenue benefits. There is great data out there that adding ultrasound to your practice can be quite lucrative if you have the right service lines, you have the right payer mixes, you have the right clientele, that it makes sense for you to bring it in-house versus there are lots and lots of ultrasound services that you can easily refer to. It will improve the quality of your care. You'll be able to get answers right away. Point of care ultrasound is really valuable to practitioners, but you need to make sure that you're not losing money, but you're making money when you add a new service line. Here are the steps for adding ultrasound services to any practice. You want to learn about your rules, your regulations in your state. You want to figure out your payer mixes, what codes are accepted, what are the medical necessities, how many can they have, what needs to be documented, who needs to be trained, what certifications they need to have, the budget analysis, what is the overhead to get it started, what is the month-to-month overhead to maintain that service line, how are you going to market it, how is it going to be charged out, is it going to include it in the visit? Is it an additional visit? Is it separate from the practitioner and it's sonographer, or it's just point of care that you're making sure that your staff is trained to bill out when that service occurs based on the management decisions of that visit problem? Training yourself, training the team. You figured out what machine you wanted. You figured out if you're renting or leasing. You now need to get everybody on the team trained so that when the machine comes, everybody knows how to use it safely. They're not dropping the probe and you're having expensive costs because they're not setting up the machine right. They're not cleaning it correctly. You've got HPV risk between the patients because of not having those quality measures in place. You can't find the machine because not everybody's storing it in the correct place. Is there certain certification exams everybody needs to take and trainings online or workshops? After you get everybody trained, you got to start implementing the policies, the protocols, the competency checklists, the standards that every year you're going to go through and make sure the machine's working properly, that everybody's keeping up with the standards, the evidence, your metrics. It's not just implementing things, but making sure that things aren't changing with rules and regulations and scope of practice. And how are you going to market it? Are you going to do 3D, 4D ultrasounds? Are you just going to do point of care? Are you going to be cash? Are you going to be insurance? Are you going to be doing it as part of the routine visits? Will it be a separate visit? Are you going to have a sonographer come a couple days a week, or is it strictly going to be for the practitioners to use? And then you got to get your equipment ordered. You got to meet with the vendors, the reps, and figure out what machine makes more sense for you. Do you want a big bulky one? Do you want something portable? Do you want to rent? Do you want to buy? Do you want transabdominal? Do you want transvaginal? Do you want certain caliber of quality? Are you looking for a $7,000 machine or a $50,000 machine? You want to work closely with your billing team to make sure the fee schedules are in the system correctly. The providers know how to charge and add that and document the things appropriately so you can get paid for that service. You want to be able to understand exactly the scope of practice. Every organization has different scopes of practices. There's ones for physicians that are a little more loose, and it's more of diagnostic versus point of care and just management support. Nurse practitioners don't have as strong it's of scope of practice referencing the ultrasounds. There is a scope of practice written for nurse midwives. It's mostly referencing the ultrasound organizations and what are their scope of practice and trainings, and if there's anything on a state level. As far as like community-based midwives, there's not a lot really written about ultrasounds. It's kind of a new gray territory. ACNM has very specific position statements for midwives about ultrasound. It's an advanced skill that people get mostly after they're done with school. It is part of standard practice, but you got to make sure you can demonstrate proper education, training, competencies. There's a lot of online and in-person certifications and continuing education available. Some facilities will have the midwives follow a sonographer and get signed off based on whatever specific point of care services they want them to be able to do. What are the requirements for your practice to have the midwives and the practitioners to be able to get insurance reimbursement and be able to be covered? What are the state regulations? Do you need to be supervised? Is it something in collaboration? Is it an independent practice? You really have to know your state regs well for every service line that you're offering. And if you're doing something that it really doesn't say yes or no, you better make sure you have overkill of procedures, documentations, things in place to show you're above and beyond the standards, because they really don't exist much. So if there is ever a question of competencies, quality measures, bad outcomes in a court world, you need to be able to show your scope, your skills, your training, your competencies, the skills and drills that you do for any procedure that you're adding. These are some of the more common regulatory guidances that are out there. ARDMS has a midwife sonography certification. AIUM, the American Institute of Ultrasound, has more generalized scope of practice. American College of Nurse Midwives and the American Congress of Obstetricians and Gynecology, they have scopes about ultrasounds. A1 has a little bit, and then just looking at your state boards, most of the time there's nothing written on a state level about ultrasound, but you just need to double check. Budgeting appropriately to implement something. There's a lot of great programs out there with Sonosite, GE, Clarius to do a month-to-month plan. And when you're paying $300-400 a month, the first couple of procedures pay for it depending on how you're billing out your services and charges, and then the rest is just profit and improved outcomes for your practice. So you got to make sure when you're doing your incomes, you got to accurately talk about the expenses. How are you training staff? How are you keeping trainings up? How are you implementing it? What are the policies, the protocols, maintenance? Are you buying versus renting? How are you documenting? How is it getting billed out? Those are really important things. Do you have someone on your team that is very seasoned? Are you bringing in an expert instructor to train and get everybody signed out, and then they'll train the next ones? How are you going to implement it to your practice? There is a midwife sonography certification. It's not available for anyone outside of being a nurse midwife or a certified midwife at this time, and nurse practitioners, but it's a great starting point. It's been out for a few years. You take 12 hours of continuing education. You take the computerized base exam. Right at this point, it's open on the summertime. And then part 2 is you have to get signed off on specific competencies. Some of them can be computer-based and some have to be in front of a ARDMS certified person. And then there's a certain amount of continuing educations you have to keep doing every few years to be able to maintain certification. Creating the policies, we provide in our trainings a lot of sample tools and templates to help with the scope of practice and common point of care ultrasound procedures that are being done. We talk about billing and coding tips and different documentation expectations, especially if you're doing transfer of care, collaboration. You got to make sure you're really able to document in clear communication what you saw in your images, how to do the calibrations, how to put the labeling on the ultrasounds, not just in your notes, is really, really important. Competency guidelines, they're going to vary based on the services you're going to offer and how it's going to be implemented. If it's a separate visit, if it's going to be grabbing the machine down the hallway, is it during triage, is it in the clinic, is it in the hospital, is it a home visit? What are the quality measures you're doing to confirm and practice what you're seeing you actually are understanding and being able to use the machine correctly? You want to document. There's a lot of things you should include with the documentation that are pretty standard. You need to put any gross anomalies. You need to put something was visible, not visible. We were able to see the ovaries. Ovaries were not visible. The IUD was seen within the uterus. There is no viable heartbeat at estimated 8 weeks gestation based on a last menstrual period. There's 2 fetal heartbeats. The crown rump length was ... You need to be able to, especially when you get farther in the pregnancy, the placenta, the gross anomalies in the baby, the fluid level, the growth. You got to be able to do certain specific things and include them in your documentation. You want to be able to clearly market the different ways. Ultrasounds are being used more and more for 3D and 4D. There's mixed things with healthcare practitioners of doing the more gender reveal and the fun versus for medical indications. The scope of practice is very specific that it should be a risk-benefit analysis and only utilized for medical indications versus for fun at this point. Purchasing versus renting, you need to talk to the different reps in your area and see what makes the most sense. If buying and maintaining it yourself is more cost effective, but most private practices and most midwives rent to get started just because they don't have the budget for a $10,000, $15,000, $20,000 machine. So you need to talk to the other midwives in the area. Do they use a butterfly? Do they use a Clarius? Do they have a pad and an app system? What mobility do they need? Or is it just a cart you push down the hallway? So you need to get a good sense of what are other people using, what are the pros and cons. I'd be very hesitant to buy ultrasound machines on eBay and just from a standard market refurbished place unless you really, really know what you're doing and what you're having those reps on your team to help you with safety and hertz, and specific ultrasound machines are used for specific specialties, and you want to make sure that you're getting the one that is best for your needs and purposes. Billing implementation, are you doing cash? Are you not charging for it? Are you going to have a billing implementation training? Are you going to use certain codes? Have you dug into the insurance companies? Are you going to negotiate some contracts? Are you going to bill it? Are you going to have it internal? Are you going to outsource to a biller? You need to really think about all these things. It's really important to plan any aspect of your service line, adding, removing, who you want to serve and how you want to serve them, to do your due diligence, because it makes more sense to make the mistakes on paper while you're doing your trial and error versus you bought the machine and then you realize your scope of practice, you can't do it. Or you thought, oh goodness, the midwife down the street who's in the hospital makes big bucks doing the ultrasounds, and then you find out it's billed out under the physician she collaborates with and you're independent. So you need to do your due diligence and make sure confidently you know what's the overhead going to cost, what do you need to maintain it, what happens if there's issues and problems with it, what's your support like, do you have to pay for it, is that included in your monthly rate, how easy is it to use, how are you going to get trained, how are you going to make sure it stays clean and quality measures and everybody stays competent. So there's a lot of things to think about, but they're all really, really important.